Good afternoon, everyone. Welcome to the private well class webinar today for environmental health professionals and what they need to know about private wells. It's hosted by the Illinois State Water Survey at the University of Illinois, which, if you're not familiar, Illinois is fortunate to have both a water survey, geological survey, and natural history survey, and as part of their scientific surveys. And we're one of the unique entities in the country. Most states don't have one. So we do a lot of water related work and support and data collection. This program, our private well class program, is funded through a grant from US EPA to the Rural Community Assistance Partnership, who is our partner on this project. And if you're not familiar with them, I'll show you a little more about them here in a second. Okay. Again, this is part of a national program implemented through RCAP. It's actually we sort of tag team. They've got staff in every state, and their 6 regional affiliates have a private well lead and sometimes several staff who are working directly with well owners and local health departments and extension and regulators to put on webinars, do assessments of wells, all kinds of things. And we're kind of the online side of things. We run the private well class through this online service and our website, as well as do these monthly webinars and a bunch of other things I'll go through in a minute that support any work that other professionals like EHPs might be doing around the country with private well owners. So it's all entirely free because we're funded by a grant, and we do record every webinar. I believe this is going to be the 128th webinar we've done, if I got my numbers right. So, yeah, and I'll go over all the resources we provide at the end. You know, we're here for you all too. If you have questions or you want someone to partner with, or you have a problem well, we're available to support all of those things as time allows. Okay, so we also offer continuing education credit through National Environmental Health Association. You know, it's a 2-year credentialing cycle if you're a NEHA member and get your continuing education that way. We're also an Illinois LEHP provider. We're in Illinois at the University of Illinois, and so it makes sense for us to do that. We work pretty closely with many of our counties and the Illinois Environmental Health Association. We don't have the bandwidth to do that in other states, at least not currently. But for NEHA, their credentialing cycle is 2 years. So for instance, if your credentialing cycle just ended and it started January 1 and you take this class today, the core material, the first 40 slides or so are, we offer this twice a year and they're nearly the same. It's meant to be helping new EHPs or folks who haven't necessarily participated before, but you can't get credit twice for this in your credentialing cycle. So I've listed the times we've done this webinar in the past. You can see we did it in May, and then last year we did it in May of 24, and then twice in 23, roughly 6 months or so apart. But there are handouts on the handout tab of your GoToWebinar window. And what we can provide is a certificate of attendance. You need the slide deck and completed forms for NEHA. I also know that there's several states that allow their operators, or I'm sorry, their drillers to participate in these webinars and get credit for it. If there's anything you need from us, let us know besides the certificate, but we're glad to support those efforts any way we can. The more you know about well owners, and many of you know a lot more about well owners than I do, but you know, we can all learn from each other as well. So for a while we offered partial credit. So if someone were here for the first hour, we give them credit, and you know, we offer this for free. And our goal in all of this isn't just to provide free CEUs to EHPs, it's to help EHPs understand better about private wells and well owners and the needs they have. And so we're not going to do that anymore. So if we have a webinar, it's supposed to be 2 hours long and give you 2 hours of credit. Typically they last at least that, maybe a little longer, depending on the questions we get at the end. But if it goes short, we'll give you the 2 hours if you're here for the entire time. If it goes long, you need to be here at least the 2 hours. And again, the point is to learn more about well issues. And we're not doing this our goal isn't to give free CEUs to EHPs. Our goal is to support well owners and help them understand how to be better stewards of their well. And you all have a role in that, an important one. We recommend that folks go to their county or local health departments as one of the first things we suggest they do. And so the more at the local level you're able to support well owners, the better off we all are, and so are they. Okay, so a little bit about RCAP. I mentioned the Rural Community Assistance Partnership. There's 6 nonprofits, which are both all listed here. Communities Unlimited, CERCAP. They each represent a region. Those are the states they work in, but they have staff in every state. So we're in Illinois. So we're in the Great Lakes Community Action Partnership area. There is an Illinois RCAP that it's at least 4 or 5 staff. Most of them are licensed water or wastewater operators, and their main role is to support small and disadvantaged systems around the country who need help with even applying for loans or grants, understanding how to take care of their water quality, helping them when problems arise, and providing advice and things like that. They also have at least one person in each region who's a private well expert, and we work with them and their staffs. And so they're out working with extension and county health and state regulators, putting on workshops, doing a variety of things, including one-on-one with well owners, doing an assessment of their well if they request it. And so it's really a great program. It's unique. There's nothing else like it to be so, I mean, it's nationwide. So we can help folks all over the country. And that's quite an awesome thing to be a part of. Best way to say it, I guess. I'm going to go back because I thought I had another slide. I removed it, I guess. One of the things that RCAP provides is a well assessment. And for any of you that work with your small communities and know they have to do a sanitary survey every 3 years, or supposed to under the Safe Drinking Water Act, it's kind of like a sanitary survey, but it's for a private well, and it's the homeowner requests it, and it's free to them. Many times they'll also collect a water sample, which is also free to the homeowner or the well owner. And but they'll go through everything from the type of pipes in their home to the last time they had their well tested, water quality tested, to look at the wellhead, determine if they're in a vulnerable geology like karst, all those things, and then be able to write up for the homeowner kind of a summary of what they found, any risks that they see that they might have, any suggestions. Like, we run into wells all the time that aren't properly sealed at the surface and don't have a sanitary well cap. We've seen things from Folgers cans on top of wells to nothing. And so these assessments are really valuable. And again, they're homeowner requested. So if a homeowner just is interested in learning more about their well and what things they should do, they can request a well assessment from one of the regions. If you go to rcap.org and then get to their private well program, you can click on a map just like this one. That'll take you to each of the region's web pages. Your other option is to contact us, which you'll see all over today. info@privatewellclass.org is our email address. So they can come out and do these assessments. They're really handy. And again, right now, for many of the assessments, they're able to also collect a water sample if you're interested as a homeowner. And so as an EHP or someone who's a professional working with well owners, that's an opportunity if they have a problem and it's kind of a sticky situation, can't figure out why something's going on. Usually, we recommend, like when I work with well owners in Illinois, the first thing I recommend is that we need to see what's going on with the water chemistry, whether that's bacterial related or chemistry related. The water chemistry usually can tell us a lot, as well as knowing if there's any bacteria in the system. And so it's really, it's an awesome tool to have available. And RCAP's done a little over 3,000, or I think it's 3,400 or so of these assessments around the country. So that's amazing in its own right. But 23 million private wells in the country in use. And so obviously there's a long way to go, but these are usually done by request. And anyway, it's a great service. And I'd be glad to talk to anyone individually after this webinar who's interested in learning more. I can give you the name of the contact in each of those areas. So the water survey, I'm really proud to work here. I've been here my entire career. We're 130 years old this year. We started in 1895 because of cholera and typhoid outbreaks. And now today we've gotten over 100 staff. We do a lot of applied research related to groundwater, surface water, atmospheric sciences, chemistry. We just have a bunch of different programs, but we also house the state's well logs. We run the state's water inventory program, which tracks all the high capacity water use in Illinois. And so we collect a lot of data. I myself have put in over 50 or 60 monitoring wells around the state that are still being monitored today, and a lot of that was in the 90s. And so we know a lot about our groundwater, and spent my entire career working in Illinois on groundwater issues. And it's just a unique organization. I don't have a PhD, and yet I'm able to do a lot of research related work that's applied and we're able to put out into the field as soon as it's complete. So yeah, it's a neat place to work. We've got a long history, go even back to getting hand pumps in parks eliminated, because those hand pumps will house bacteria. They're lift pumps. They've got valves in them. Those things hold water. During the summer, that thing gets heated up. You can see the little tin cup there, where back in the day, everybody just came up and started pumping and got a drink of water from the tin cup. They shared it. We're a long way from that today, but that's the way things were back then. And I always like to show this well log when I get a chance, because I mentioned we house the state's well logs. So this is in Schuyler County, and after the Depression in the early 30s, one of the I think it's what's called Community Conservation Corps was put people back to work trying to get things done. Every state was given some money, and they allocated it how they saw fit. I know if you go to Indiana to some of the state parks, there's a lot of the state parks, the work that was done to really develop those, like the paths and everything else, were done through this program. In Illinois, they hired people to go out and inventory wells in part of the state. So this well is 60 years old at the time, and this is from 1934. So what's interesting here is this is a 135-foot hand-dug well. And if you're familiar with water wells, these old hand-dug wells are typically very shallow. They're taking water from the water table. They're not very safe. And the idea that somebody dug a 4-foot diameter hole 135 feet down is just astounding. And they used a bucket and chain. And if you read through this a little more, which I won't do today, it's because they tried a different kind of pump and it just was too much work to lift the water that high. So the bucket seemed like the best way to go. Yeah, the water stands at 60 feet. So how they got to 135 feet, I have no idea. But it's pretty interesting, some of the information in our records. And with that, we'll get on to today's topic. I'm Steve Wilson. I'm a groundwater hydrologist. So I have Katie Buckley with me, who's a water resources outreach specialist. I haven't mentioned it yet probably, but if you have questions during the webinar today, you can go on the question box or the chat box on the GoToWebinar window that you have, and you can ask questions there. Katie's going to track those and put them in a shared document. And at the end, we'll pull those up once we're done with the webinar in total. And so if you have specific questions that don't get answered, we can try to answer those, or at least we can give you information on how to get an answer. And we'll stay and answer those questions as long as you all want to ask. Also have Sally Dolan, who's an EHP and also a senior scientific specialist here, who also provided some of the answers today, as well as Aaron Huggett, who Aaron and Sally manage our new help center, which we, through our funding, we launched in April, a help center that's online. I'll show you that near the end. But it's basically, you can call us, you can email us, or you can chat with our chat bot to get answers to questions related that you might have. And we're available during work hours during the week every day. So it's a pretty cool service, and a lot of people use it and find answers online through our knowledge base, which is a database we put together. So they're all answers that we've provided. So it's no junk or misinformation or any of those things, as well as then if it's a really tenable problem, a lot of times that's when we get a phone call. When it's something more complicated, yeah. And so we're here to try to help, I guess is the bottom line. So we're going to cover today is really, it's about environmental health professionals and how the issues and challenges we all face working with well owners, no matter what your profession, and then why well owners are so tough to reach, and then a little bit about groundwater and wells. And one thing that's important is the gap between groundwater and health professionals. This comes up time and time again. A groundwater hydrologist that may have a geology or engineering degree looks at the world a little differently than someone with a public health degree. But when you're working with private well issues, we really need to work together and use the things we each know that the other doesn't to make things better. And that's kind of what I'm going to talk about today. And then lastly, we'll talk about our private well class program and all the things that we offer that help you not only reach well owners, but work with them and hopefully answer some of their questions. So there are a lot of issues out there related to private wells, flooding, you name it, but it really comes down to these things. It's public health protection. First and foremost, what are people drinking from their well or their kitchen sink? It's also source water protection. If you have old abandoned wells or you have a well that's not protective at the surface, you could be contaminating not only your well, but you could contaminate the aquifer and affect others. And then, lastly, water quality and how that, what that means for both. The folks that work in the remediation realm, where they're actually cleaning up like hazardous sites and all that stuff, to a person, and it's an industry known fact that it's about 20 to 30 times cheaper to put the things in place to protect something being contaminated in the first place than it is to try to remediate it after and get it out of the ground. And so it's really a good thing for people to realize and understand that a lot of the things we've done in the past have caused us a lot more costly remediation that if we were just aware and diligent and did some best practices, we might not have some of those issues. And again, there's a lot of issues in the news: drought, flooding, contamination. Now it's PFAS, or when it was lead. I mentioned boil odors here because we also have a problem with well owners who maybe don't really understand where their water's coming from, even though they're on a private well. So a boil order is issued by a local community when they have usually a main break. So their water main breaks, it's under pressure, it's a system that's closed. When a water main breaks, it could allow bacteria into the water line. And so that's why a community gets a boil order. They have to boil their water to make sure they're not drinking water that's been contaminated with bacteria until they can fix that water main and everything's back under pressure. And then once they've tested and understand that it's okay, they'll lift that. I have water operators tell me that they get calls from local private well owners near their hometowns when they issue a boil order, and it's in the paper, on the news, or these days on Facebook or some other social media, but not understanding that it really has no effect on their well. And I bring that up because to me, there are really two issues. Oh, and I guess I took that slide out, or I have it later. There's really two issues that are the most prevalent and what we've found working with private wells. One is anytime a well is installed, it's installed to current code today, but in 10 years, the code's probably going to be a little different. And before 1978 or later in some states, there was no well code in a state. So wells were hand dug. I grew up on a hand dug well that was my grandpa dug in 1933. It's only 14 foot deep. It's in a ravine. When it rains, the water's cloudy. It's totally unprotected. And that's what I drank growing up. So my grandpa put it there because he knew there'd always be water, because water runs on the surface down to this ravine. He also just assumed that because it's a well, it's safe. And so did my dad. And so that's what we drank. But that's not the case. And a lot of folks just don't realize that. So really the well owner knowledge and education thing is really one of the biggest issues, as well as folks still using those old wells, whether it be a hand dug well or even a well that was first constructed in 1960 or whatever. They didn't necessarily use grout all the time. There's a lot of rules today. And, with that, there's also a couple states that still don't have all the same rules as the others. So the challenges we face really are about that. What is a private well? I just mean the definition. What is the definition of a private well? It varies by state. And whether you permit or submit a log varies by state. So in some states, I'll use Illinois as an example. We required well logs and permits through our county health department starting in 1978, I believe. It's close to that date. In other states, it was much later. New York, for instance, they didn't require well log submittal until 2000. So think of all the wells that have been installed in New York State prior to 2000, 25 years ago. And there's been a lot since, but they probably have 10 to 15% of all the well logs of actual wells. They only have logs for that few because they weren't required. And the difference between New Jersey and Pennsylvania, New Jersey has some progressive rules. They passed a law 20 years ago that requires at every home sale or property sale with a well, it has to be sampled following state rules and for a set of constituents that the state requires. They can, the owner, the buyer can pay for it, the seller, they have to agree on that. They don't share the individual results with anyone but the buyer and seller to protect property values and things like that. But they've been doing that for 20 years. They get about 13,000 samples a year because of it. And so if you go on New Jersey's website and look for their private well water quality information, they've got all these cool maps. They actually protect an individual well by showing a 2x2 grid. But if there's naturally occurring contaminants like arsenic or radon or radium or whatever it might be, uranium, all of those things you can see if an area has those because of all the work that New Jersey's done. Pennsylvania does not have well construction code. They've never been able to get that passed through their state legislature, nor do they have a licensed driller program that requires competence in drilling to have a license. And I'll show you that in a second. Especially because of state budgets, some states have much more wherewithal to actually implement the rules they do have, where others really struggle and don't have the resources to go out and do anything extra that might, be considered a research or a proactive effort to ensure more folks their water quality safe. So same thing, many times county or local health departments are not adequately trained. I know when we started the private well class in 2013, the first year we had nearly 1,000 participants. 22% of those folks were environmental health professionals. And in those that provided comments at the end through the evaluation process said one of two things. One, why wasn't this available when I started my job? Or two, how do I get credit for this? Which is where we're at today with working with NEHA and making sure some of those things do happen. But a lot of folks started a county health department as a generalist or working on other things. They get thrown into all these new areas to work on because they have limited staff. And so they may be looking out if they're a state where they're actually inspecting all the wells that are drilled as they're being drilled. There's a few of those, not a lot. They may be out there and not really understand what's going on. So in the end, though, all of that leads to what I'll call a very unorganized local approach to support in most parts of the country. So it's, you have, even in Illinois, we have counties that are haves and others that are have-nots. We have some that are in areas that are economically depressed. Their health department doesn't have much resources, where we have others in wealthier parts of the state where they have their own lab and they're doing their own water quality testing. And they have the wherewithal to do a lot more. And that's the same at the state level. We have some states that have very little additional funding to be proactive. As I mentioned, we have others where their citizens have actually passed amendments to tax themselves so that their health department and their environmental issues have the funding they need to actually learn and grow and provide adequate information. Which, those are the envy of most of the other states in the end. I want to mention Pennsylvania because one of these webinars, I said, Pennsylvania doesn't have a licensed driller program, and someone in the chat, went off on me about, yes, we do. Well, what I meant by that wasn't that you can't be a licensed driller, because everybody on this webinar can go on this webpage and pay their $60 or $80, whatever it is today, and get a license that says you're licensed to drill in Pennsylvania. No experience, no continuing education requirement, no test to take. And on their website, it says a license does not imply that a driller has knowledge of proper drilling or well construction practice. There's no statewide construction or siting standards. ultimately, across the state, it's the private well's responsibility of the homeowner. So that's sad. It's unfortunate. And what's happened though in Pennsylvania, to their credit, at least to the citizens' credit, is there's been a lot of local issues and local groups like a watershed group or even the Pennsylvania League of Women Voters for a long time were raising money and providing resources for research to look at private well issues in Pennsylvania. So locally, people don't like this in Pennsylvania, and so they've done their own part to try to pass rules. I know there's a few areas where they've locally passed an ordinance that requires a driller to be a master driller through the National Groundwater Association, which is a voluntary certification that a driller can get through the National Groundwater Association. But I think that's great because they have to show some wherewithal and that they have experience and they understand drilling techniques, all those things. And so there's 2 states that still don't have well construction code. I know Alaska has a work group that's been working on trying to get that done. In Pennsylvania, I'm not sure if there's been any more efforts. I know one of the champions for Pennsylvania was with Extension and he retired a couple years ago. And so I'm not sure where that stands, but it's how things are so different in each state and how, or even at different localities, you know. I should also mention, like in a state like Connecticut or Massachusetts, where they're home rule states and they're governed by local health districts, not by a county health department, each health district has the ability to pass their own rules. So we actually have 1 or 2 of those local health districts where they can actually condemn a well because they've given themselves the authority to do so, where the very next district over, there may be no rules for private wells. And that, you know, when you think about that, you're looking at a state like Massachusetts, where there's 351 or so local health districts that all can have different rules. Where in Illinois, we're 5 times larger than Massachusetts. We have about 86 health departments that are county or multi-county based, and they all follow the same rules through our Illinois Department of Public Health. So it's really all over the map, and that makes it very difficult to give well owners advice and to understand, you know, you could move across the street in Massachusetts and the rules are different. And that's, you know, I don't think it should be that way, but that's not my issue. So this is a slide I thought was up after the flooding slide. These are the 2 issues that really affect wells more and water quality than anything else. Poor well construction. These are, you know, we did a dug and bored well study. We were sampling for ag chemicals. And we are in an area of Illinois where there's no real aquifer, so they're all large diameter dug or bored wells. And you can see how some of these covers are. The one with the brick out actually had a toad in it when we were there. You can't make this stuff up. So, and well owners not understanding that what it means to be a steward of a private well. And that's really hopefully what we can help do through our program and with everyone's help, is get everyone to at least go through the basics of what it means to be a well owner and have some of that common knowledge that at least make them more inquisitive, help them ask better questions, and you know that's kind of where our goal is. So the other issue we have is that well owners come from every demographic, every social class, economic class, education class. Some have been on a private well their whole life. Some are lived in the city their whole life and just moved out to a small home in the country where now they're on a private well and have no idea. I grew up in a rural area on a farm, but Cook County, Illinois, which is Chicago and the nearest largest suburbs, has 3,000 private wells. When I tell people in Illinois that, they're like, there's no way there's 3,000 private wells in Cook County. It's all urban. It's completely urban. And yes, there are. And that's where municipal boundaries don't match up, or where there are certain ordinances passed, you know, in the 50s that gave these small areas their own kind of autonomy, if you will. And so you find pockets of private wells and septic systems in areas where they really should be on community water supplies. So as far as water testing, most people have never tested their well. So Barb Luukkonen, who was with University of Minnesota Extension, her and 2 colleagues did this study where they sent out a survey to 2,700 people in 6 counties total, 2 in each of Wisconsin, Minnesota, and Michigan. And they were doing this as a social experiment. So in Wisconsin, they gave out a $2 bill and a free test. In Minnesota, it was just a $2 bill, and in Michigan, it was just a free test. And you can see how the results were. The more incentive, or people feel like, well, you gave me $2, I can fill this out. They had a much higher response rate. That's kind of what they were after. But what we're looking at is the bottom left here, where it says 52% were not worried at all, and 35% were only slightly worried. And these are all people who don't treat or haven't sampled their well. And then they also asked a laundry list of about 20 reasons why people haven't tested. These are the top 10. And you can see here, we've been drinking it for years. Well, yeah, I've been drinking it. I drank the water in our well for, 16 or 17 years. And when I came to the U of I to school way back in the day and was drinking city water, if you will, community water supply water that's treated and chlorinated for 3 months, I went back home and I drank our well water and it made me sick. So it was because I had built up and was used to the bacteria that are in our well. But once you lose that, and my point to that is when I talked to a farmer who said, I've been drinking this for years. My dad drank it, my grandpa drank it. You know what? Your kids moved away? Do they bring your grandkids over? Because they've not drank your water for years. And I guarantee if there's any issues, they're going to find it. And so all those things matter. The last one, I don't want to know, I actually had that happen to me. We were trying to sample a bunch of wells in a rural subdivision where every home had its own well for arsenic. We have an aquifer here that's known to have arsenic in it. We were trying to look at the spatial variability. So a subdivision's a great way to look at a pretty close proximity to the difference in arsenic concentration in an aquifer. Most of the wells were nearly the same depth, all in the same aquifer. And I had one person who said, you can sample my well as long as you don't tell me the results and you do it when I'm not home. And so I did. I sampled it. And when it was all said and done, I asked him why. He said, because I'm trying to sell my home. And in Illinois, you're required by law to fill out the survey. One of the questions is, do you know anything adverse about your well or septic that needs to be reported? And it's legally binding. And he said, I wanted to be able to honestly answer, I don't know anything about what might be wrong with my well. So there are reasons you would never think of for why people do some of the things they do. Not saying the guy is right in any way because I don't agree, but it's the situation we found ourselves in. So yeah, there's really these break down into categories why people don't test. They didn't realize they should is a big one, and that's kind of on all of us and others in the education field to help people understand that it's important to test your well, even though it's groundwater, even if it's a deep aquifer, even if it's properly well constructed. A lot of times there won't be anything, but you just don't know. And we do have naturally occurring contaminants that it's no fault of anyone's, it's just there. Arsenic's one of the more common elements in the Earth's crust. So we find it in groundwater in some places, depending on how that aquifer, if it's a sand and gravel aquifer, how that was deposited, or whatever it might be. The other is just really a lack of understanding of the risk. Well, it's probably fine. A lot of people have drank this water and not got sick. Well, a lot of things like I'll use arsenic again. I did a lot of arsenic research for about 15 years. It's long-term exposure. Drinking it at levels what's considered through the Safe Drinking Water Act for community water supply, it has to be below 10 ppb, 10 parts per billion. And what they consider safe is if you're going to drink that water for 30 or 40 years, a given amount every day, it increases your risk of getting cancer from arsenic if it's above that. So, in that area where there's high arsenic, I've run into families that are like, I grew up here, I've lived here my whole life, it hasn't been a problem for me. They're not going to do anything about it. And their arsenic level in one case was over 150 parts per billion, which is 15 times what's considered safe through the US EPA. I can give them all that information. They can choose it, there's no legal requirements, so they can do what they choose. Other reasons why they're hard to reach, they believe groundwater's safe. That was my dad. He was like, well, it's our well is safe, it's protected. And even though it isn't, And really human nature is another big one, not only because, why don't people go to the dentist when they should, or the doctor? They put it off because one, you're a little worried about what you're going to find. And that leads into, the cost or perceived costs. Well, if you're just getting by and you're worried that someone collects a water sample, even if they provide that for free, if it shows that I have to add, a $1,200 treatment device and then maintain it, that's going to cost $300 or $400 a year. Now what? No one, unless there's someone who's going to come around and offer to help with that, which, that's where the disconnect is for a lot of us. There aren't a lot of programs that offer those type of services. So these other things, some people just don't trust the government or a university. They'll call if their pump stops or their well stops working, or one of those things, but otherwise they're not going to do anything proactive, at least if I recommend it, they're not. So I want to talk a little bit about aquifers and wells, just for the basics. If you go on NGWA's website or even USGS's website, they talk about well types when they're really talking about drilling types, whether it's dug or bored, drilled, or driven. And that really has no bearing on how you, as someone working with a well owner or a well owner yourself, need to understand what type of well you have. So there's really the three types of wells that I recommend we classify, if you will, this by, is based on the geology that's determining where your water's coming from. A dug or bored well is a shallow, large diameter well. It's meant to be like a storage tank. So a lot of times they're bored down to less than 50 feet. They're at least 3 foot diameter, and they're there so that water can seep in slowly and store water, so that when you use it, there's no real aquifer there, which means there's no mechanism for water to quickly refill a well. So it fills in slowly, and I'll go over these in a minute. Or they're very old, like the one I grew up on. And then there's sand and gravel wells, which is a specific type of well construction that's finished in sand and gravel. If I had a jar of sand in my hand right now, it's just like that in an aquifer. It's just sand. You can pour water through it. Water moves through it quickly. The only way to get the water out is to pump it out through a well. But if you don't have a screen that prevents the sand from coming through, you're going to pump sand, and that's bad. So sand and gravel aquifer is very prolific, and a lot of times we see, and especially bottomlands along a river, you see these large irrigation systems that might pump 1,000 or 1,500 gallons a minute. They're pumping out of sand and gravel in general. And if it's a thick sand and gravel aquifer, 100 feet thick, that's a lot of water. The porosity of that's like 30%. So for every 100 feet of sand, 30 feet of that is water. So yeah, and it uses a screen. So the water's only coming in through the screen, versus a bedrock well, which, water doesn't flow through a piece of rock. It flows through the cracks and fissures in rock. So the only way to get water out of a bedrock well is if you hit some of those fractures and then have that open to be able to pump water from it. And so you don't have casing all the way down like you do in a sand and gravel aquifer. And so it really depends on where you're at. You may have a bunch of choices. I know where I'm at in Champaign County, Illinois, we have 2 glacial sand and gravel aquifers, and then there's bedrock below that. No one here drills into the bedrock because there's no need. The water quality is no better. It costs more to drill deeper, and the sand and gravel resources here are sufficient for even irrigation wells. But you may be in an area where that's not the case, and you may not have a choice, and the water quality may be of a certain type that requires treatment from the beginning. There's just all of these different nuances to what can happen. And really, you just need to understand what you're dealing with whenever you talk with someone who has a private well. So a bored well, as I mentioned, is large diameter. You can see from this picture, this is actually in a soybean field, which I thought was very interesting, that they're putting a well in a field where you're using pesticides. They're a legume, you don't necessarily put nitrate on. But it's a 3 foot diameter hole, or 3.5. And then the way that's finished is with concrete tile put vertically at 4 foot sections. And because it's not cemented, each of those sections, they fit together. There's a male end and a female end, but it's still not watertight. So if the water table in the shallow clay material is say 4 to 6 feet, or if it's shallow, then every one of those seams is going to allow water to seep in, and it'll go up to where the water table is. And so the water table is different than the water level in an aquifer. The water table is where the ground becomes saturated from land surface. We have other webinars where we talk more about some of those things. These are all examples of a dug or bored well. The one on the top left is an old hand dug well. You can see how the ground is kind of tore up around it, and those posts all look like they're worn totally down. And then there's 2x6s and 2x8s with pieces of tin and concrete blocks and rocks holding it all down. Well, that's a cattle pasture. And the reason those posts are so worn is because the cattle come up there and scratch. Those are great scratching posts. And then they also do their business right there. So you have this area that's wet, and it's on a slope. Water can seep in from as shallow as 3 or 4 feet in all likelihood, or less if it's actually brick. I don't remember. This is a well we did sample. It's been a long time ago. And so, and you have a field right up gradient of that, which is going to have runoff. So a really bad situation. The other two, the one on the bottom left is, it's really a 4-foot concrete tile, but it doesn't start until 10 feet down. So they've got this normal well cap on top. And then the one on the right is the tile I mentioned, the concrete tile, like culvert under a road. It's just 4 foot, it's 3 foot diameter, but 4 foot sections. And I'll just go over a little bit quickly how those work. So the picture on the right is the image on the left here. I said that backwards. The picture from the last slide was the concrete tile all the way up to the surface. And you can see the 4 foot seams, and you can see where it turns blue. That's where the water table is. And so there's these little sand lenses, but it's mostly fine textured soil, silt, clay. A lot of times in glacial materials, you have very little sand. It's further down and becomes the aquifer. And so, but because of where the water table is, water can seep in, and it fills us up overnight. You use your shower in the morning and do laundry or whatever. Then overnight it'll fill up again. And in a dry time, like we had some dry summers where we would be without water for 2 or 3 days, just because it was that dry. And so these are susceptible to that. We see people all over who have a bored well, and they'll go get a tank or have someone bring out a water tank with 1,000 gallons and dump it in here. It's really a bad idea because it's just going to seep out into the formation. If the water level is that low, then it is everywhere around that, and it's not going to hold water. The other side is the one I showed that had the metal cap and metal pipe. Here, the concrete tile doesn't start till 10 feet below. And this is just a later design that's meant to help be more protective of surface infiltration. So even though the picture on the left shows us concrete around the well for the first 10 feet or so, and that's the code in Illinois, having this fill there is another way to do that with a cap further down. And that, again, is just a way to help keep surface infiltration that gets into the ground from getting down to the well and getting in it, and provide a little more protection. Sand and gravel wells, I mentioned they have a screen. This is a screen. So it's slotted, the space between each of those, it's woven stainless steel, this particular one. And the space between each of those pieces of stainless steel is called the slot. And the slot size depends on the size of sand or gravel in the aquifer. So when a driller is drilling a sand and gravel well, they'll pull up samples. It's usually reverse mud rotary, if that's what it is, or however they're doing it. But then they'll sieve those out and determine how fine the sand is or how coarse it is. And one of the rules of thumb is if you're in an aquifer that's sand and gravel, the coarsest material's on the bottom and the finer material's on top. And that's just because when, at least in northern climates where you've had glaciation, as water melted, the glaciers melted, and then the heaviest stuff falls out first as those rivers start running, and the finer stuff falls out at the end when the velocity is less. And so you usually see stratification in a sand and gravel aquifer, and a lot of times they're trying to get near the bottom of that sand and gravel, no matter how thick it is, because then they're less likely to start pulling fine sand through the screen, which is abrasive and hurts pumps and can hurt your pipes in your home and all that sort of stuff. but it's sized based on the sand in the formation. And it just, usually that's a call that you make in the field when they're drilling. Casings, usually PVC or steel. Most of the time, screens are stainless steel for a private well. I know they do make PVC screens as well. And we use PVC screens for monitoring wells just because it's not going to be used for any kind of consumption. It's really to take water quality samples or to monitor water levels in a given aquifer and see how that changes over time. This is just a schematic of a 200-foot well. I use that as an example. So the screen's usually a 4 or 5 foot screen at the bottom. So in this case, it's solid pipe down to 195 feet, and the last 5 feet is a screen. So the only place water can get in the well is through the screen. And that's important because that means anything on the surface has to go through not only that upper soil, finer textured material, then it has to go through all the sand in the aquifer. And here there's only 2 units. There's the darker brown and then the tan and the bluish tan. That's the water level. That's all 1 unit. So the sand is partly dry. And you can see where the water level is, and that's also the water level in the well. And water's coming in through the sand. And when you pump this, water can freely flow through the sand in through the screen and replenish this, which is why you can have a much higher pumping rate in a typical sand and gravel aquifer. But the important thing is the water's coming in at 195 feet or deeper in this example, because it's not the same for a bedrock well. So here's a well log from Illinois, and I just show this to show you the kind of information you can get off a log if there is one. On the bottom right, it shows you the geology, tight sand, and sand and gravel. And again, the tight sand means it's finer. It's actually harder to drill through. But as you get further down, you get into more gravel, and that's actually better because you can your screen. So here they use stainless steel screen, 20 slot. Yeah, I think it's 20 hundredths maybe. And the location, all the well logs in Illinois are public information. You can go on our State Geological Survey manages a GIS server that you can bring up a map of Illinois, scroll into your area or an area you're interested in, and you can find well information there. But you can get also a lot of information about the well. And so here, right above the geology on the bottom right, it says the static water level in this well was 159 feet. So the sand didn't start until 260. So the fact that the water level came up in the well higher than the aquifer means it's under artesian pressure. So this is considered to be an artesian well. Doesn't mean it's flowing. It's still at 159 feet, but it's the whole aquifer is under pressure. It's not an atmospheric pressure like a aquifer that's not full would be. The pumping level was 165 feet, so it only had 6 feet of drawdown in the well, pumping at 20 gallons a minute. They didn't list the hours here, typically 2 hours. But it's the fact that it only dropped 6 feet in the well, 100 feet from the well, it probably dropped less than 6 inches. And so this well will pump, if it's big enough and had a big enough pump in it, could pump probably over 1,000 gallons a minute. The aquifer is that good there. And this is also just came with the log. This particular company has some software, so they put it all in there and provide that. And the message is make sure that if you're inspecting the site especially, that they're providing as much information as they can. And because when you look at some states and the well logs they have, there's just very little useful information in those. And the more you can provide, the better, because down the road you don't know when it's going to come in handy. So the other type of well is a bedrock well. And as I mentioned, you don't get water. If I am holding a piece of just one rock in my hand, water doesn't go through that. It doesn't have water in it. Water's running through the fractures, which you can see in this diagram. And there's one larger fracture here, and then we colored them light blue. But those fractures dictate what kind of water you're going to get from your water supply. So the only way to hit those fractures is to not have it cased. If that casing went all the way down to the bottom, you'd cut off the fracture as well. So when you drill a bedrock well, typically you put the well, you finish the casing 10 to 20 feet into the rock, you seat it in the rock so that it's sturdy, and then the rest of the drilling, you're drilling through solid rock, you're creating a hole, that is your well hole and well bore. And then you're hoping to hit fractures so that you have some water. And we have an area in Illinois where they're actually using bedrock for irrigation. And if they hit fractures, they can get as much as 1,000 or 1,500 gallons a minute. And if they happen to miss any major fractures, they might get 30, which isn't enough for, a center pivot irrigation system. So it's really a difficult situation in some cases. You might spend $30,000 on a well that you can't use for irrigation. But again, the water's coming from the cracks in the rock and fissures in the rock. And why that's important is because we have a lot of areas in our country where bedrock is at land surface. So today, most states have rules that say if you're going to drill in bedrock and it's at the surface, the casing has to go at least 50 feet. And that's just meant to help protect from everything right at the surface getting right in the well. But older wells in those areas don't necessarily have 50 feet of casing. An example would be in New York. I was there working with the Indian Health Service a number of years ago on some tribal lands where bedrock is right at the surface. Some of those logs had 16 or 12 feet of casing, and that's it. So it means water can get in that well bore after 12 feet. And when it's already fractured rock at the surface, if there are any fractures that actually came up to the surface, that's a direct conduit, just like pipe flow, into the well. And so they're not safe. And we certainly found where some of the septic systems had contaminated some of the wells and things like that because it's just not protective. And so you really need to understand the geology here and what that, here we've got the overburden. There's a saturated part of the water table and then the finer soils on top. But where is, how deep is it till you get to bedrock, and where is the casing end? That's probably the most critical question, because a 200-foot well in bedrock, like the one we showed for the sand and gravel, this well may only be 30, 40 feet of casing. So it means water can get in anywhere after 40 feet. And that's less protective, especially because fractures can run longitudinally in a long direction. If you only hit one fracture, it could be water coming from a half mile away. And so there's just, it's just more of a concern in general. Here's a bedrock log for Illinois. Going back down to the bottom right, you can see that they hit, they had 12 feet of sand and boulders at from 175 to 187. Then they hit broken limestone, which is the top of the bedrock. And then they hit solid, or limestone bedrock, which is the aquifer. And then they got down to 257. They hit shale, which means they're out of the limestone formation. So they stopped because they're not going to get water from shale. It's cemented clay, which really doesn't have much, doesn't let water really move through it. So in this case, the aquifer, the limestone, started at 187. Everything above that was unconsolidated sand, silt, and clay because we're glaciated in northern Illinois. But you can see the pipe, 5-foot PVC at the surface from 1 foot above land surface to 179 feet, and then black steel from 179 to 199. I'm looking at number 15. So they put 20 feet of steel casing at the end because when you seat that in the rock, it needs to be solid. And with PVC, you could crack it if you try to seat that too strongly, if you will. And so they use steel, but it's cheaper to use PVC. So then they put PVC above that. But there's no casing after 199 feet. So everything's just an open hole. It's whatever when the drill rig drilled through that and created this is a 5-inch diameter casing. So it's probably a 6-foot or 6-inch well bore or 6 3/8 or something like that. So below 199, there's a 6 3/8 hole that goes down to 260, and water can come in to that borehole if there are any fractures that it happened to cross. So, and even here, this is a confined aquifer that's artesian. The static water level is above the bedrock. It's at 130 feet. And when they pumped it for 25 gallons a minute for 2 hours, it dropped to 160. So in this case on the left, they show that they set the pump at 160, knowing they're not going to pump 20 gallons a minute or 25 gallons a minute. They put in a pump, I think, that only pumps 12. And, it's a direct relationship. If you're pumping 25 gallons a minute and you have 30 feet of drawdown, you're pumping 12 gallons a minute, you're going to have much less. And so since that's more than the pump can manage, it's likely that that's plenty of pump and plenty of depth for that to happen. And if something changed and all of a sudden the pump started breaking suction where the water level in the well is dropping to the pump level, They can always then add sections of pipe onto the pump, drop pipe, to raise it, to lower it there, rather than having to drill another well. They've got down to 260. Okay. The other thing to deal with is poor well construction, which I've mentioned a couple of times, but it's because we didn't have well code. I say 30 plus years, now it's more like 50. I probably need to change this slide. But all existing wells are grandfathered in. So even a well that was drilled 10 years ago, if the code's changed in your state, it still meets the old code. That's a lot to ask folks to go back and try to retroactively do that to a well. In some cases, it's impossible. You'd have to drill another well. So that's just kind of been the standard. But that also means folks with an old dug well were able to continue to use that if they wanted to. So, and that's just the way it is. And in northern climates where you have a frost line in the winter, where the soil's frozen for the upper 2 or 3 feet or more, if you're up, in Alaska where there's permafrost and all that stuff, they used to put wells in pits. They didn't understand that you could run a line out the side of the well at depth, like 3 or 4 feet below land surface, and run it into your home. And they invented a pitless adapter in the 60s that allowed that to happen, so you could have your straight well pipe all the way up to the surface. But in the old days, they dug a pit, put your well, a whole thing, like a little enclosed box with the well down below 3 or 4 feet, so in the winter it didn't freeze. Those are such a risk. They provide, not only surface water can get in those and flood the well if you have a big rainstorm, flood the whole box, if you will, the whole area that's been dug out. But well casing, and especially well caps over time, if they have they may not stay airtight or watertight. And so if water overtops that and gets into that basically a little cave, if you will, it's going to get into the well and cause bacteria problems and things like that. But they're also a safety hazard. So a lot of these were not properly taken care of or forgotten about. People fall in, they get hurt all the time. Here's a couple examples. So I'm just showing this picture again. Walt Kelly was my colleague. He's retired today from the well we've sampled down in Southern Illinois. But the two pictures, the picture on the upper right or left is from the Washington State Department of Ecology, which is the primacy agency, if you will, the agency that regulates drillers and well construction code in Washington State. They had a blog for a while where they were putting out information about things like this. This old dug well that's using corrugated pipe for a well casing. That's in a little well house. You can see all the gray stuff around there. That's likely, I would think that's probably insulation that's been eaten away either by mice or just by time. It's a suction pump. You can see there the blue suction pump on top. Well, this piece of plywood, woman probably walked over that 100 times. And this particular time it broke, she fell in and it killed her. Not a good way to have your well. Not a safe well to even use. You're talking about fiberglass and everything else getting in there. I'm sure there's mice in there. You can see the funnel that was probably for oil for the pump, just laying there. Just a bad situation. And the picture on the upper left, Don Kelderman was down in Southern Illinois the same time I was. I was there for a meeting to talk to a bunch of irrigators, and he was researching his family history. He had found this old cemetery plot and an old farmstead. Luckily, this wasn't in use anymore, but this is an old stone well, and whoever had the property had taken a piece of culvert, concrete pipe, and stuck in the well, but it wasn't covered, and it was only a few inches above land surface. So there was a goat farm nearby. A goat got out, somehow managed to find its way into this well. And this example isn't a well that's being used, but I probably have a dozen sample examples of where a well is being used, and it's either got frogs, snakes, you name it, in it. So people don't understand that they need to protect the surface of their well from anything getting in, anything even small. That's why you have to keep the vent on your sanitary well cap. If it's got a vent tube, you have to keep the little screen on there because bees will get in it and ants, and they'll build nests in there and cause all kinds of problems down the road, bacteria problems that'll get in your water, or could even cause other things to build up on the casing. Yeah, it's some of these things you just can't make up. So what do we do with these? You should bring them up to code. If you can, I get it that a well's an expensive adventure these days. One of my colleagues just had to put in a 120-foot sand and gravel well, which 15 years ago would have been $6,000 or $7,000. Today it's 12, and so it isn't a cheap endeavor to fill in a pit. We still see them out in at least in Illinois. Some places in rural areas we'll see a well in a pit. We certainly encourage people to just put in a pitless adapter, bring that pipe up to the service and fill that pit in. And you can talk to your well authority or a local driller or contractor or your county in Illinois, a county health department or a local health district about the best approach. Extension in a lot of places, a lot of states would have some good advice. But it's just a risk, not only for the drinking water quality, but even safety. So, and the same thing with abandoned wells. Since well logs weren't required till so late in the game, there are many places where there's an old farmstead and it's got an old well. And at the time, the kids decided to tear down the old house that was from the 1800s and build a new one and get a new well at the same time. And I'm going to keep that for the garden. Or, we might want to use that if we get any livestock down the road. And it gets forgotten. And these wells are a huge safety hazard and a potential source of contamination. We find these old wells where it's like, oh, there's a big hole in the ground. That's a great place to dump my empty containers of, pesticide or oil or whatever. And not realizing that if that gets into an aquifer, they could be contaminating not only their well, but also their neighbors. And there's also a risk there, a legal risk. If someone were to walk on your property, whether they have a right to be there or not, and they fall in and it kills them or they get hurt, you're likely to be liable. And that, the best thing to do is to get those filled in so they're properly abandoned and not a risk to anyone anymore. Some more examples. These are both from that same blog. King News, and the bottom one there is in Washington State. And so pulling a horse out of an old well that was in a pasture, and the one on the bottom, this Sheldon Washington guy, he was in his backyard, had no idea there was a well there. There was actually grass over it. He stepped on it, went through, fell 45 feet. His neighbor heard him, they got him out, and he walked away, which that's a great story. Very lucky that happened. But we had that happen here in Illinois just 2 years ago. We got a call from a homeowner with a well. She was mowing her front yard, and it's an old farmstead out in the country, and her riding mower kind of dipped. And then when she went back over to that spot, she could tell that something was hollow underneath that. So they called us, and I said, well, it's either an old cistern or it's an old dug well. The house was from 1910. And sure enough, we got there and we dug that out, and there was a 16-foot old dug well in the front yard. And she's just super lucky that her and her lawnmower didn't go right down into that. And that it fell on top of her. She'd have been in big trouble. So, and then all the newspaper clippings are from the 90s. The big one is the third one, Jessica, the little girl that Jessica McClure, was covered on CNN, if you're old enough to remember that. She fell down into a well and was stuck there for, I want to say like 18 or 24 hours. They had to kind of dig her out. She just fit. She sang along the way. They got her out. Everything worked out well. And again, it was covered live on the news nationally. And she's a mother of 3 today. So you never know. Some folks weren't that lucky. So. As far as groundwater and health gaps, groundwater is complicated. I mentioned here in Champaign County, we have multiple aquifers. We have 2 sand and gravel aquifers. They actually have different chemistry. And that's because they were laid by glaciers hundreds of thousands of years apart. And there's also places where there are wells, but there's really no aquifer. And understanding that, we've had some folks who want to look at cancer research, and they're like, well, we want to look at this area. It's really difficult to tie that to well water because there's so many things you don't know. How long they've lived there, if they actually drink the water. A lot of people don't. If they have any treatment, you really have to have all that information in advance, or at least be able to collect it for the time period before. So there's really no easy way to do retroactive research on how well water might affect public health in a given area based on groundwater. It just really can't be done. And we've talked to a number of health professionals about some of those issues. You almost have to just start doing something and collect a bunch of information, and then over time you may be able to come up with something, which is an ideal situation if you do research. But it is what it is. Well water issues aren't straightforward. So people don't necessarily understand the difference between well water and city water. And I bring this up, Johns Hopkins, because they were helping CDC with a strategic plan for private wells. And, they took the list from EPA for all the things that can go wrong water quality wise in a community water system. Well, the EPA's list includes all the things that can affect surface water, like algal blooms. You don't have algal blooms in private wells. There's no sunlight to allow the algae to grow and some of those things. And so they're not the same as community water supplies, and you can't try to compare them necessarily. Even wells that are groundwater supplies or communities that have groundwater supplies, the way they're monitored, the distribution system you have, all that stuff makes it different than what you have in a home with a private well. There's also groundwater samples versus drinking water samples. So our lab in Illinois, until 2008, was able to offer any homeowner in Illinois with a well a free water sample for inorganics and metals. And because that was state funded, we were able to give them 2 sets of bottles, and we had them do just this. We had them collect 1 groundwater sample and 1 drinking water sample. So the way you do that is the groundwater sample has to come from an outside spigot that's close to the well, that doesn't go through the home where there might be any kind of treatment, even a filter or a softener or anything else. You let it run until you hear the pump kick on the well, and you let that run for 5 or so more minutes. Actually, when we were doing this for research, we would even we'd hook a device up to it that measured conductivity, pH, and temperature, and we waited for those things to equilibrate and not change over a few minutes before we felt like we were really getting a groundwater sample. So then you can compare what's in the groundwater versus what they're getting out of their kitchen tap, because they're going to be different. If you have any kind of treatment, depending on the type of pipes you have in your home, they're very different. And so now, since 2008, the samples we get are just drinking water samples, which have been through softeners, sometimes RO or UV, or all kinds of different treatment devices. And so it doesn't help us as groundwater scientists understand what issues there are in the groundwater in those areas. But you need to understand which data set you might be working with. So yeah, there's other things dealing with well construction issues, understanding the differences in those well types. And again, no information on whether people actually drink their water or they're using bottled water. I have a colleague who I just assume he's on a private well. I learned, it astonished me that he goes to Walmart and gets these 10-gallon refillable bottles filled up, and that's what he uses for his drinking water. And this is someone who knows a lot about wells and those sorts of things. Anyway, but not having that information and not knowing, there's no way to go out and say, well, this area has a higher incidence of some kind of cancer or other kind of issue because people have well water here, and it's probably because of that. Because you basically have to know for each case of someone who got a particular disease or whatever, whether they drank the water, whether they used bottled water, whether they had it, what kind of treatment they might have had. So the bottom line is, any team working on these things, it really should have both. We both have a lot to teach each other, if you will. And when you see a group that feels like, they can do it without the other side, if you will, I feel like they're really missing the boat, because they're not going to necessarily come up with all the same findings and be as thorough and comprehensive as they could be. If now, the big thing, even like funding from the National Science Foundation, is about developing these teams of people from very different disciplines. So you get very different viewpoints, and you have to converge on what works for everyone. And those tend to be the most important factors. And I put lagoon example here because we developed a well assessment tool. And to do that, I reached out to a bunch of different professionals, county health department staff, state regulators, drillers, extension, a couple groundwater hydrologists. There were 12 of us, I think, in the end, and we developed it all together. And I've been in Illinois my whole life. I've worked at the Water Survey for well over 35 years. And I did not know in Illinois that a homeowner is allowed to have a lagoon as their septic system or their wastewater discharge system. And there's a number of states like that. I think Nebraska, Oklahoma, Illinois. And the person who happened to be from one of our county health departments, who was the head of the environmental health group, she's like, yeah, we have one in our county. We have one lagoon that someone's using as their for their septic, if you will. So we can all learn is the bottom line. And this is just, so the bottom sand here is this tannish color. That is the Mahomet Aquifer. And above that, so each of the different, B, if you will, is above that glacier that came. And then there's been 3 glaciations through here. I'm not a geologist. We have the pre-Illinoian, the Illinoisan, and the Wisconsin glaciation episodes. But from that, you have places where you only hit one sand as you go down. You have other places like where I put my red arrow that you touch on 1, 2, 3, 4, 5, 6 different sand and gravels. And without being able to see when you're drilling which one of those you're in, you don't have a lot of confidence that you're actually in the Mahomet yet, which is the aquifer on the bottom. It's a big aquifer here in Illinois, covers 13 states. It's as much as 150 feet thick, and it's full of water. But yeah, you could have wells in any one of these. A driller may be drilling and hit 8 or 10 feet of sand, and there's plenty of water, and it's artesian, so the water levels come up in the borehole, and they're like, well, this is plenty, and they may just be in some minor aquifer in the area that we don't even have mapped, which is very possible. So, because this type of mapping is a lot of its interpretation from a few well logs to know that there's actually there's organic zone in some of these areas or whatever it might be. So it is really complicated. And to understand glacial geology and where these wells are finished, you really have to have a handle on all that. So the best thing to do is develop a relationship with your scientific surveys or groundwater resource agency, USGS, the state GS, and Illinois, the Water Survey, as well as, all the agencies that regulate wells, DNR, DEQ, DHHS, depends on the state, DOE and Washington State, for instance, as well as Extension. Bring in all the partners you can, and your team will be that much better. And that's kind of my message in all this, because that's what we've learned is that, especially when I work a lot with public health professionals, and it's a very different mindset, the way you are all trained and what you value as far as, it's just a good way to look at things in a different way, you know what I mean? And so it really complements what my skills are. I know I really appreciate it and get involved with things with NEHA as much as I can, and our county health departments. And we work, like I said, a lot with our Illinois Environmental Health Association. A lot of times we go there and give presentations on what we're doing particular year, all that sort of stuff. But all of these things matter: geology, hydrology, well construction. And so you need folks that are experts in those things if you're going to build a team that, or not even build a team, but if you're working with well owners, have those folks as a resource. Know who, if you have 4 drillers in your area, go talk to all of them. You're going to figure out that at least one of them is really interested in helping you and is very knowledgeable and is a straight shooter. And, because you have that in every industry. You have that, find the people that, one, think like you do, want to help, and actually are knowledgeable. And, those are quite a resource to have. Okay, so I'm going to talk about the private well class here in the next 15, 20 minutes. The way I put it here at the bottom is, what can I do to help private well owners understand their wells and water better? This is the first thing they can do. They can sign up and take our class. It's completely free. It's sent as a PDF once a week for 10 weeks to their email address. They're on their own to read it, but it's all the information they need to have a better handle on figuring out where they can get information about their well. There's one of the lessons is just about how to find local information, and it goes through examples actually using Google searches. Just be inquisitive is all they have to do to figure some of these things out. Some states will have that information, some states won't. Maybe a county does. Maybe a local driller still has the information. There's all these options, and so going through all this helps you understand, one, how your well can be contaminated, the things you can do around your well to make sure that you're not contributing to that, understanding the best practices, all those sorts of things. And then we supplement that with we have videos, podcasts, webinars, and we put on a conference for professionals, which I'll talk about here in a minute. So this is our front page. There's 2 buttons at the top: visit the help center, which I'll talk about a little bit later, and take our free class. So when you click on take our free class, it takes you to this page that says enroll in class. You click on it, explains what you're doing, and then it takes you to this page where you can, your first, last name, email address, and location is just your state. And part of that is, we're sponsored and funded by the US EPA. We're supposed to run a national program. This allows us to show them that we've had well owners in every state take our class. We've had, I believe, a little over 13,000 people, it's close to that, who have taken our class now. It's been vetted by a lot of folks. I think it's pretty solid. And and when you sign up for things as a professional, it will sign you up for our newsletters, I believe. This is kind of new. We've switched to a different content management system. And so I took a nice screenshot of it, but I haven't actually tested this out myself. We also developed a Spanish version. There's a URL at the bottom. We felt this was important, and a number of people in especially populated areas where there's a lot of wells. Think of places like Raleigh, North Carolina, where there's a lot of private wells in their county. It's Wake County. They have a lot of Spanish-speaking folks, and we were encouraged to do this. And it doesn't get a lot of traffic, but all the lessons are in Spanish, as well as some of the videos. And we were able to do that because U of I is a major research university, and we had a young man from Columbia who was here on a Fulbright scholarship, who was passionate about providing Spanish language materials to the folks in the states that need it. And he actually did all of this himself. Very smart. He was getting his PhD in civil engineering. And so we've got it all translated, and this has been available for a while. Even the images, which we've updated some of these, the English side, but he redid them all, so that it explains everything. And then we vetted that through some of the folks that we work with at RCAP that are in areas like Southern California or the border of Texas, where the dialect's a little bit different. Spanish might be a little bit different, and so we had a bunch of people review this and try to make it as sound as we could. For each lesson, under the resource library, there's these tabs for each of the 10 lessons. First lesson is called The Science of Groundwater. So each lesson's maybe 6 to 10 pages long, and it's got pictures or figures. So it's not a ton of text. It's all the basics, but we list these resources as additional things that people can look through and to learn more. And they're pretty useful. A lot of people tell us in the evaluation that they've looked at some of these. The webinar today is like this one in 2023, is My Water Safe to Drink. We record every one of them. And so those are available down the road. You'll see at the end where we ask a lot of questions. We try not to answer the same questions every month, because we do have some people who come on every month, but we also have new folks, which is why we redo these every so often, because we have new people who signed up for the class and have just found out about it. So again, our focus really is on the private well owner, and everything else we do is really to support that. Funding, financing options, it's the biggest question we get, is questions about how to, my pump failed or my well stopped working or whatever, and how do you get funding for that if you're low income? And it's a really trying thing, because private wells are not regulated. They're not mentioned in the Safe Drinking Water Act on purpose. And having a private well, many people choose to do that, where when something goes wrong, it's completely their responsibility. So we go over a lot of different options that we've uncovered. Many of them are not for big things like replacing a well, but for testing or abandoning a well. There's programs out there through different groups. And then we've done some specialty webinars. This is the last time we did this on lead. We did this webinar twice, once in 2016 and once in 2018. But we've covered everything that a homeowner on a well really needs to know. It's not changed. It's about, a lot of older homes in a rural area are going to have lead pipes or galvanized pipes. And so it's really a risk for everyone, depending on the water chemistry that's going through your pipes at the time. And so we created this page. Actually, this is just privatewellclass.org/lead. That talks about these filters that are available, which US EPA, when all this stuff happened with Flint, they did a lot of testing and found, there's a number of these filters that you can put on your faucet or use a pitcher. They actually do a great job of removing lead. And so we try to provide that information to folks. And then we have 21 of these videos, which I'll call training videos, as I listed up here. What should I know about a shared well? I know there's a shared well question. It's kind of open-ended. The big things with a shared well are that if you don't have any kind of legal document in place and the well is not on your property, you're always at risk that whoever owns the well may decide they don't want to share anymore. When the other thing we've seen is that, two people have been neighbors and friends for 15 years, a pump fails, and all of a sudden it's going to cost $16,000 or $12,000 to replace whatever it might be, or, that was exaggerated. I meant to say $6,000. Which we've seen for a pump replacement. One of them can't afford it. It causes all kinds of problems. And so this kind of goes over some of the basics of what you should know. I will say also that Washington State is the one state that regulates down to 2 homes on a well is a special class of public water supply. I think New York also regulates below 15, which is the US EPA standard. If you have 15 or more homes or 25 or more people on one water supply, it's considered a public water supply and has to meet the regs under the Safe Drinking Water Act. So that led to folks like some of the contractors who are building subdivisions. I know this happened in Illinois, where they put one well every 5 houses and hook 5 homes up together because it saved them money. And it's the biggest disservice that they could have ever done to the folks who are buying those properties. Anyway, we can't do anything about the past, but to understand how to protect yourself, it'd really be a bummer to wake up one morning and your neighbors say, well, I disconnected your line because I don't want to share it anymore. I don't want the liability or whatever. It should be in the deed, or you should have a contract for that. And then why does my well keep losing pressure, and how does my pressure tank work? 2 of the most popular videos we have. It's really just explaining the basics of a pressure switch and how a traditional pressure tank works, and why what it tells us, and there's 450,000 views of one of these, is that a lot of people have pressure problems that are on private wells and don't understand, in theory, it might be as easy as changing the settings on your pressure switch from a 2040 to a 3050 or a 4060, which is a shut off and startup pressures for when your pump kicks back on to refill your pressure tank. But these days now, with the zero, the 1 gallon pressure tanks that are really just meant on startup and the variable speed pumps, that is going away. And so in those cases, it would just be a matter of making sure you have a big enough pump, to reach the 3rd floor with enough pressure that you're not suffering in the shower because you hardly have any water pressure. But a lot of good information there. We do a podcast. It's called Tap Talk. It's actually, we have 2 sister programs. Besides the private well class, we run a program called the wateroperator.org. That's for small community water and wastewater systems and the operators that run them. And then we also have a site called decentralizedwastewater.org, which is really servicing the decentralized wastewater industry, all the pumpers, installers, septic installers, and regulators. But we do a podcast that's kind of meant for all of those groups. So a number of these are just about private wells. Brian Swistock is retired from Penn State Extension, by far the most knowledgeable well person I'd ever met. He was a loss when he retired, for sure. The others here are all top of their field. Alan Wolf is the head of Boston's Children's Hospital's pediatric hospital. He deals with a lot of strange cases of children's illnesses, and some of those lead back to private wells. Really interesting conversation. We just interviewed Terry Morris, who's a CEO of the National Groundwater Association. That's in one of the current episodes. If you go to this website, which is just drinkingwaterpodcast.org, which I forgot to put up here, I apologize. Katie can put that in the notes. But yeah, they have a program to help with financing. When people go, the one place you can get financing for wells is USDA, but the requirements are pretty strict. You have to actually be only at 60% of the poverty level to get funding, and a lot of folks don't meet that. But if you've gone to USDA and been denied, then they have a program called Water Well Wish. It's interesting, and they get drillers who volunteer that are members of the NGWA, and they help put in wells for people. It's pretty cool that they do that. So overall, that's all of our program, and these are really the goals of all that we do. We want to help well owners understand why their well is important, and they need to take it seriously. They can't just assume their tap's going to turn on. They need to know why that happens, and understand how it all works, as well as then protect themselves from any risks there might be, and why you should have a sanitary well cap, and why you should test annually, and all the things that are recommended as best practices. And so there are a few more resources here I want to talk about, and they're really geared towards the EHPs. And so the first thing is that NEHA, we've been able to put our class on NEHA's e-learning center. It's available. You don't have to be a member of NEHA. You do have to register and have an account, but it's free, and you can get up to 10 CEs through NEHA, even if you're not a member of NEHA. Apache is one of the home inspector associations. They also use NEHA's website. They came to us and said, we'd like to set up this for our inspectors. I'm like, well, we already have something like that for NEHA. And they're like, oh, we work with them all the time. And so I know some of their folks go on there and get accreditation that way too. The more people understand about wells, whatever they're doing. If it's a realtor, we do realtor webinars. If it's labs, labs are answering questions for well owners. Or home inspectors. The more they know, the better it is for everyone. And so we feel fortunate we've been able to get this out and to so many different groups and venues and all that stuff. If you want hosting workshops around the country, the RCAP regional staff are glad to work with you. If you want to have a thing at your office some evening just on private well issues, we can give you the name of the contact in your state or your region. They'll reach out. You guys can discuss what you want to do. They can do anything from leading it to finding speakers for you to advertising it, all those sorts of things. And it's nice to have that in your back pocket if you really want to get into some resources, or you need help, like if there's a spill or something happens and you don't have those resources, you can call them or us. We usually can get to those too pretty fast. And so, and again, we developed this assessment tool. It's like a sanitary survey. It goes through a whole series. There's 18 sections of things that it covers. And so, and we have a partner newsletter. So going back to the enrolling class, what I didn't highlight last time, because I want to talk about it here, is at the bottom under that button, there's another sentence here about EHPs can now receive up to 10 continuing education credits. If you click here for more information, it takes you right to NEHA's website. It's free. You can add it to your cart. If it turns out you don't have a login, I think you will have to. Yeah, you have to log in first. And then, yeah, I'm gonna go back. I went too far. But anyway, you can sign up for that, get an account, and then you can take that way, and a certificate will print out. For that, you have to answer the questions though. There's questions at the end of each lesson. You have to get at least 70%, all the things that you expect from an online sort of a class. And that is not available for Illinois EHPs. It's only available through NEHA. So under the resource library, we also have a thing called partner resources. We put out a newsletter once a month. It has a lot of really valuable information in it, in my opinion. It's well done. It keeps you up on what's going on around the country as well. We highlight some of the things that are going on when we're having webinars, when some of our partners are. Like when Penn State Extension has a webinar, we list it. If Texas A&M Extension is having something, we list it. All those sorts of things. And it really is just a resource for you if you're a professional, whether that's an EHP or a driller or a lab or a realtor. There's a lot of good things in there, and you can look through those. We also have, if you get down to the bottom of that, we have this some other resources that you can pull up, as well as this is our newsletter. This particular one, this well is an old dug well. It's in the middle of Macomb, Illinois. It's 4 blocks from downtown. They've had city water in Macomb since 1916, and yet somebody bought this home and they discovered that this concrete pad with a little hole in it along their back foundation is an old dug well, and the hole is where there used to be a hand pump. So there's a groundwater guardians group affiliated there with Western Illinois University and some of the professors, and so they set up this education day for, I'd say there was probably at least 15 different county or regional health departments that came, and we had a field day and we sealed this well. The gentleman putting the bentonite in there is with Gingrich Well Drilling. They provided all the bentonite and a skid loader and a bunch of stuff free of charge, and which was really great. We participated, we made a video, and we provided some of the resources as well. But then we made this nice, I think it's 5 or 6 minute video on how to seal abandoned well, at least following code in Illinois, using bentonite and gravel. And it's interesting because the person who lived there before saw that little hole in the ground and was a smoker, because when we opened that up and took the pad off, there's probably at least 10,000 cigarette butts down there. It was only like 18 foot deep, and 3 or 4 lighters, and luckily it was dry. And this is, like I said, this is a community that's on city water, and this home has been since 1916. So, but we try to provide some of those resources. Septic Smart Weed every year is in September. It's a great program ran by US EPA. There's a lot of resources on their webpage. We actually do a webinar in July that's just about septic systems. And so, yeah, these assessments, we have a fillable PDF. They've done over 3,600 of these since 2016. I think I've talked about some of these things already, so I'm going to skip through very fast. We did develop a guide to help people, because really you have to be you have to have a fair amount of experience with private wells and all the issues that are related to them to understand and fill this out. And this isn't for a homeowner to fill out, it's for a professional to sit down with a homeowner and fill out. So things like backflow devices on spigots, if it's a frost-free or, whatever some of those things, you really need to know what all those are. So we put together a guide that for every section of this assessment tool, which there's over 500 individual boxes to either fill out or click. We list what that means. We explain what those devices are. And part of it's, if it's a spring, you can still do an assessment on it instead of a well. And even what to do before you go out there, what to do after, so that you're providing the well owner with the best information possible. We've had a number of groups actually do projects where they've used this assessment tool and then sampled, and they're using that information publicly to identify areas where there's problems in water quality. There's a group in Massachusetts that's looking to actually create statewide regulations, and they use the assessment tool as part of the sampling protocol. And they've actually got a lot of traction, because there's certainly some contamination issues naturally occurring in parts of Massachusetts. And so trying to protect every homeowner like community water supplies are protected is a big deal. Similarly, at the end of 2023, we developed a tool for on-site wastewater systems, septic and advanced systems. It was developed in conjunction with NAURA and some of the RCAP staff that work on these issues. And so it's also available. I don't work with that as much. Sally is much more involved in that side of things. And yeah, that's also available on our website. I meant to take this slide out. This was our first national conference. 2017, we had a national stakeholder meeting. We had 117 people come from all over the country, 32 states, and we met in Champaign, where we're at, and we put on a conference. So we had one in 2019 in Harrisburg, Pennsylvania. Then the pandemic hit. So we had virtual conferences in 21 and 22. So we've got the funding. We're going to host an in-person conference. It's going to be at the Bloomington Normal, Illinois Marriott Hotel and Conference Center. It's right downtown. There's a lot of restaurants, and it's right near the Amtrak and bus station, all those things. It's May 20th through 22nd. I encourage you to go take a look. We're accepting abstracts through February 10th. what we're looking for, this isn't a research conference, it's a practical use conference is the best way to put it. It's for practitioners. It's for county health departments and regulators. We're trying to bring in people who are doing novel things in their own local areas that benefit well owners. And so if you know of someone who's doing extraordinary work or a lot with a little, and they might be interested, we can't certainly pay for every speaker, but we do have some funds to pay for a few speakers who don't have travel funds. And so I encourage you to submit if you have, it's not just to hear about your program. We can have 20 people talk about their free sampling during Groundwater Awareness Week. We're looking for things that other people can take back and use to make their program better. And so along those lines, these are all recorded, even in-person conferences, and we make them available on our website, which you can see it down there below. If you just go to privatewellclass.org/conference, you can get to all the recordings on our YouTube channel. And especially the first 2 years when it was new, there was a wealth of people doing novel things out there that hadn't had a chance to actually go out and give a talk about or even tell anybody about, that we found out about. And so there's a lot of neat information about how people were able to leverage funds from one program to actually support private well owners with another and things like that. Yeah, we had Barb Luukkonen. I talked about her study. She was our first speaker, and it was really interesting. She showed a picture of them ironing $2 bills to make them look new. It's a really interesting talk. We've had Barb on our podcast. She's very passionate. She is retired, lucky for her. We brought her down here anyway from Minnesota, and I think she had a good time, and we certainly did. And yeah, again, these videos are all worth watching. And in 2019, we went to Pennsylvania. It's one of the states that doesn't have well construction code. So our first speaker was a hydrologist. They created a local ordinance for their watershed. Todd Giddings is registered in Pennsylvania. Interesting stuff. You can't make this up. So this brochure I kind of showed it a minute ago. It's a trifold brochure. We developed it really with the idea that a county or local health district can put this on their table where people come in and go to the front window, and it just says, is your well water safe? So this is the front side. It's tri-folded. We print it. We have it folded and bundled in packages of 50, and we send it to people who want it for free. So we've printed 98,000 of these already and given out most of those. I think we've given out about 93, something like that. And so we left this spot in the middle with a yellow box here. That yellow box isn't really there. So that whoever gets these, whether it's a driller or a hydrologist or a lab or whatever, they can stick their own label on that. So now you're providing people access to you, and also giving them some advice. And I'd like to take credit for this, but it wasn't my idea. It was one of our staff, but it was a great one. And so if anybody wants any of these, you can contact us, and we will give them to you for free. And when we run out, we'll print another batch. I think the last time we printed 6,000 or 5,000 of them, and I know we still have some of those left because we just did that a few months ago. It's also available in Spanish. Again, thanks to our Colombian PhD student. And yeah, it was great to have that access. So also, if you follow us on our newsletter, we will let you know when we're getting ready to print again and say, if you'd like some, here's a deadline to submit an order. Again, we print them. We work with a printing company here in town. And this is older. This is from 21. It says 80,000 brochures. Now we're up to 98,000, I think. And yeah, we take orders so we know how many to print. Is usually the way this works. So our hotline and the help center, and we probably should take hotline out of there and just call it a Private Well Help Center. We were asked to do this under our EPA grant, and EPA has been very supportive. They actually list this on their webpage, their Private Well webpage. But so you can get to it from our front page. And Sally Dolan and Aaron Huggett, who are both here on the call today, manage that. They're the people you'll talk to if you call. And it's really useful because it's a lot more than a phone number. You click on that and it takes you to this page where you can click on the little bottom right little button, the chat button, and you can ask a question. it takes all of the transcripts from every webinar we've done, the 10 lessons and all the transcripts from those, all the words in that, plus other stuff that we put together, and we threw it all in this database. It's custom, and it'll create an answer based on that. So all the answers are consistent with the message we've been giving for the last 10 years. And that's to me important, because a lot of times you hear different messages from different folks. Even how to disinfect a well, there's so many different things out there. Some of them are really poor and some of them are pretty good. But what you'll get here is a consistent message nationwide. Or you can just search for an article. The knowledge base is a set of articles. An article really is a question and an answer. And so I'll do that here. I put in flood. These are the resources that came up as far as questions that we've created a knowledge base answer for. And then when you click on that first one, is my well safe after a flood? This is actually the text from one of the videos we created on is my well safe after a flood, and what you need to do. If it's been overtopped, you need to disinfect, all that sort of stuff. And so what that's done is, we heard some of these hotlines get so many calls. We get a ton of traffic. We just launched this in, I think, the middle of May, maybe in April, can't remember. And we've had, 12 or 13,000 people go visit the knowledge base and ask, look at, 16,000 questions or something like that. It's a lot. But we've had, 300 or 400 calls. But what we've learned is all the phone calls from this are actually really complicated. There's somebody who has a really distinct issue, and it's not solvable by reading an answer like, well, how often should I sample and what should I sample for? That's in our knowledge base. What do I do about having this unseasoned galvanized pipe as my drop pipe in my well in Wisconsin, which is a real question we got. That requires us to actually look into it and work with folks who are corrosion experts, and that's what's happened. But it's also increasing our knowledge of things that we'd never even seen before, which is really cool. It's just we've traded one set of questions for a completely different set of questions is what we've done. So getting to the questions we have, so as you registered for this webinar, it asked you if you want to ask any questions. So we did get a fair number of questions, actually fewer than usual, but we will answer a subset of those today. And if we don't answer your question, you can send us an email. A couple of them that were really specific. One of them mentioned 2 counties. When I looked for the first county, there was that county in a number of states, so I couldn't even narrow it down. And so, that kind of stuff is kind of beyond our bandwidth. But we try to answer the questions that are going to benefit everyone, and or have more general application. And so we're going to get to those now. And if you have a question, it looks like some people have already filled this out, are already asking questions. You can use the chat box or the question box to ask a question if I don't get to it, if I don't, answer it. But also obviously the help center, the knowledge base is a good place to check for things too. And so yeah, first, for example, are rapid tests using strips recommended? Well, we don't recommend using test strips or any of those home tests, because many times they're there may be even presence absence, but they try to do more. Maybe they're colorimetric. A lot of times they have, they're less rigorous as far as the method that's being used. So they have false positives or false negatives. So someone will spend $50 on a test kit and it says there's nothing there, when 5 years later you learn that, yeah, we did have arsenic in our water this whole time. You sampled it for some other reason. And it can leave you exposed to a contaminant you're not expecting, or it could lead you to spending a lot of money on treatment you may not need. And so, if it shows you do use one of those tests, which we do not recommend, send it to a certified lab. It's your family's health. You need to take it seriously and put resources towards it. It's important. It's really, you wouldn't drive your car and not change the oil, even though you don't want to spend the money to change the oil. You do it because otherwise, it's going to ruin your car, right? But I said, for example, because this is, Sally's already put this up as a article in our knowledge base. And so you can see a more complete answer than I can put on this slide there. And that's the difference. These are relegated to a few main points because it's on a slide and we're trying to get through them. Where this knowledge base, we can put the more relevant questions in there. Not all of them. Some of them are just very specific, and we can, and then you know where to look. What should I know about private wells to pass the NEHA exam for RHSS? Well, Sally did that, and so we asked Sally. Her response was, and this is partly an answer from in May, and also she gave me some more information for today. The main point to remember is that these test your competency as a generalist. So you're gonna have to have a broad set of knowledge on private wells, regs, type of wells, all the common contaminants, how to, the construction stuff, all that. And that test, and everyone I've talked to who's passed it or taken it says it's very hard. And so getting up to study every morning for 3 months seems like, and I'd say getting a NEHA guide is worth the money. And also doing like an OSHA training, then, how bad do you want it is the bottom line, because it sounds like, it's not something that you can just spend a weekend on and pass. So yeah, that's our answer there. Do wells work if the power goes out? Well, typically no, because pumps are ran usually by electricity. But if you're in an area, so I grew up in the middle of the country in rural Illinois. We had an ice storm when I was 13. We didn't have power for a week, but we had a generator. And back then it wasn't one of these fancy ones that runs every month and, cost thousands and thousands of dollars. We had one that was a Honda motor mounted on a 4x4 piece of plywood that we had to drag out of our building, walk over to a power pole, switch the power away from the line out to the electricity line, and then fire it up and make sure there's always gas in it so we could run our well, our heater, our furnace, our furnace and our fridge and freezer. There is a market these days for hand pumps. That's not my favorite suggestion, but there's more and more people who are living off the grid. They don't have any electricity, so they're using some of these things. But depending, you need to understand your situation and groundwater availability. Where a hand pump might be an option, there are also those piston pumps, right? It's an old hand pump, really, where they're lifting water and they've got valves to keep it from falling back down. Well, water sits on top of those little closed valves and can get bacteria in groundwater naturally. If they sit, they'll form biofilms. The only time I would use it, especially if it's not used very often, they're going to grow bacteria. And so, which is why hand pumps were outlawed, I want to say in 1924 or might be 32 in Illinois in public parks. Same reason. So any water you take from that, you'd want to disinfect. And, that's either adding chlorine to it or iodine tablets, or you can boil it. But if you're going to do that and as an emergency, that's what I'd recommend. Anything that's going to be used for drinking anyway or cooking. Well maintenance. How do we handle upkeep monitoring wells over the years? Really sign up for our class, even though we do have a post in our knowledge base on how to maintain your well, and it lists like 9 things there. You're gonna be so much better off if you just go through the class. I don't know how else to say it. Of all the people that have taken it, the comments we've gotten, everyone rates it really highly. They learn so much about their well and what their situation might be and how things work and how to ask better questions. If you haven't taken the private well class, the 10-lesson class that you sign up for on our webpage, that is really the first step. But then, these things help you. And, I've been doing this for a long time. And when I get calls from well owners, typically it's because they have a problem, not because they're trying to be proactive and learn about their well. And I'm telling you, I tell them, you need to be proactive about your well and understand it. You need to, you're the water operator for a very small water supply, and you need to take that seriously. Is manganese a problem in private wells other than color? Yes, flat out simple. Manganese is listed on EPA's website as a secondary contaminant that's for aesthetics, causes staining. But over the last 3 or 4 years, it's been identified as a cause of neurological problems, especially in children. I had it was my niece. She's a farmer. She sent me her water sample, really high in manganese. She said, should I be drinking this, Uncle Steve? So I went to an expert at US EPA, and when I showed him the results and said it was my niece, he's like, don't let her kids drink this water. And there's no legal limit nationally, but a number of states have passed a legal limit for community water supplies, and that's what we use. Just like for arsenic, the standard for a public water supply is 10 parts per billion. So we tell well owners, you should try to drink less than 10 parts per billion because that's what's considered safe for a public water supply. And there are no other real enforceable regs. And there's health goals and other things out there. Some of them are really stringent, and they're not necessarily based on the same science. And so we stick with what the MCLs are. And if there's not an MCL, that's when we go look in somewhere else. And so manganese is very common. These two filters are from our aquifer, the Muhammad aquifer, which I mentioned earlier. One's a brand new filter, and one is a filter that's 2 months old. If you just had iron in your well, this thing would be brown. But the fact that it's so black is because there's an equal amount of manganese and iron. And typically we find, especially in our glacial aquifers, we have a lot, when there's a lot of iron, there's a lot of manganese. And it's, your kids should not be drinking it, really no one should above a certain level. And, we don't have all of that information on our site yet, but we're going to put it up. I think we have a number up there, but I'm not sure it's the right one. And I need to review that. But, there's states like Minnesota, if you go to their health department's webpage, they do have additional information. But the bottom line is it's a risk. And anyone who has high manganese in their well water, they shouldn't be drinking it. And again, the problem is it's very common. And usually you see it with iron. They both can be treated the same way. You pull both out. This is just a filter. It's oxidizing the iron and manganese and then catching it on a filter. That's what this gentleman was doing. Working with tribes. Do you all partner with tribal organizations regarding well water? Yes, we do. We actually, as much as we can. If we get a call, both our private well program and our water operator program. I went out to California to, I think it's a Cahuilla tribe, and gave a day-long seminar on all the things that we do related to wells and water systems. Several times Indian Health Services asked us to help out. I know I went to New York and helped out there where there were some real issues with some corrosive water. We're going to be at the tribal conference that RCAC and Region 9 put on every other year. It's in Reno in April. I'm going to talk about decentralized wastewater stuff and wateroperator.org this time, but we'll be there with a booth, and so we can certainly talk to anyone who might be there. Yeah, we've worked a lot with Cherokee Nation in Oklahoma. They have a really proactive, well-ran environmental office. And so like when we put out our well assessment tool, Cherokee Nation reached out to us and said, hey, could we modify this a little bit? Because we have a lot of cisterns on our lands, and we want to be able to go out and do these assessments, and whether it's a well or not. So yeah, we did. We changed it and put their logo on it and sent it to them, and they use that. And they're a good partner. So yeah, and I'd welcome any opportunity, or if anybody has a need, just reach out. That's part of what we do. And we'll work with anyone, honestly, that's trying to learn more about wells and protecting the health of their folks in their area. How do agencies best estimate the time of travel for water resources when establishing wellhead protection areas? Well, there's pathline analysis is the time of travel can be ran backwards in time with the groundwater models to delineate what a capture zone would be. First one I ever ran across was in 1987. It was developed actually by a guy working here at the Water Survey. It's called GW Path. I looked, it's not available anymore, but there's GIS methods now and everything else. I know even some of the technical assistance providers do this for communities where they will get all the available data. That's really the key. You need to understand the geology, the aquifer characteristics, and if you have any hydraulics, what's the permeability, what's the porosity, you have any of the flow or velocity measurements. So more information about how water is going to flow through that aquifer, then you can use a more sophisticated model and actually determine, a 5-year, 10-year, 20-year capture zone. But we also see that in a lot of cases that data isn't available, especially like for a non-community system. And so, there's published data on soils and aquifer materials as far as some of those characteristics. And you can use a simple 2D model of that aquifer. And, it's basically using Darcy's law, which is the equations that govern how groundwater flows through the ground. It's really the same as electricity. It's the same equation. Water flows through the ground like electricity flows through a wire based on resistance. And yeah, it's kind of cool. So yeah, there are certainly ways to do that. I didn't have an opportunity to really look up more, but our groundwater section, which I used to be in, we used to do a lot of that. And now you can get online and search for tools to do that. And I can ask if you want more information, email us, and I will ask one of our groundwater folks to follow up, because it's been 25 years since I've looked at any kind of capture zone analysis. But certainly, depending on the data you have, it's a good way to understand where your risks are and where to set up groundwater protection areas and things like that. Is there ever a reason to contact your local health department? This really surprised me, and I can't figure out for sure if it's just a homeowner or if someone's playing devil's advocate here or whatever, but I'm going to say that I guess you're new to our webinars and our program, because we recommend since the beginning that that's probably the first place you should go if you have a question or an issue, is go to your health department, your local health district or county health department. Many times they know the most about your area. They know if there's water quality issues. They're there to protect your health. I did mention earlier, there might be a couple local health districts where they have some additional authority. If you're concerned about that, 99% of the country, your health department cannot tell you to not drink your water. They can suggest you don't. They can say it's a really bad idea if you do, but you're really on your own to make that decision. But there are a couple health districts out east where they have given themselves that authority. You can always ask them first. If I give you my water chemistry information, is it possible you could condemn my well? You could go ask somebody else. And not that I want to slight those groups that are doing that, but the law is just so inconsistent. If you're really trying to do better and get advice, then you should be able to do that without risking your water supply, in my opinion. And if that doesn't work, contact us. We get calls all the time from all over the country. We've developed relationships with not only state folks, but county folks and extension. I just had a group in Texas contact me and want me to come down for a 2-hour thing, which I told them if we could plan a week, I'd come down and speak a number of times at over a week. That I can do. But to come down there for one day for 2 hours, so I reached out to Extension in Texas, which I know their Texas Well Owner Network would be glad to go down to Houston and give that presentation. And so that's who I gave them to, and they're working that out. So we've, through this program over the last 10 years, and I said here at the end, I said, only one time in the hundreds of contacts I've had with local health departments have I ran across someone who wasn't really that into it, didn't really want to help. They basically weren't interested and said, we're not funded to do private well work, so we don't. Every other time, they've been very helpful. They understand that private wells are a big issue and they're not as covered because they don't have the same regs as septic systems or food inspection or some of the other things. So that is the place to start, is with your local health district or county health department. And that's what we'll always recommend. What is the best website to find an old well record? Being from Iowa, I use the Iowa Private Well Tracking System to find wells, but that doesn't show all of them. Well, I'm assuming that system shows all of the actual well logs that they have records for. Like in Illinois, we house the state's well logs. We know there's about 800,000 private wells in use today. We only have about 450,000 well records. And some of those are wells that have been abandoned. So when I go out in the field, I hired 5 geology students once to go out and inventory every well over 9 townships. And it was a very rural area. There were 1,706 wells. We only had logs for 788 of them, not quite half. And, Illinois is ahead of the game, really, on the well logs we have on file. And our drillers have adopted early and all those things. So the only other option you have really is to start talking to some of the local drillers. it's either the company's still in business and they may have it, or if that company's not in business or you don't know who they are, some drillers are more than willing to take other people's records. So when a company goes out of business or they decide to give up being a well driller, they'll ask a neighbor or a competitor, do you want our well logs? And I've seen that happen in Illinois at least twice. We had one bring them to us. And so it's possible they're out there somewhere, but I mean, we're really a needle in a haystack at this point for finding an actual log. Like what we would do is if you came in and wanted a water quality analysis, we would create a piece of paper for our well records with your location and any information you did have about your well, but we'd staple the water quality record onto that, and that would serve as the well log, because that's the only information we have about that well. But at least now we know there's a well at that location. So yeah, it's really where we're at. And there's a lot of places where there's no well records. It's just the way it is. It's unfortunate. Hopefully not today, because most states track that a little closer today. 2 questions about testing and sampling. How often is raw well water sample required? And is it mandatory for domestic well testing? Well, there are no rules requiring testing and sampling that I'm aware of, except for property sale in 4 states: Rhode Island, Connecticut, New Jersey, and Oregon, I think. I know it's 4. I can't remember for sure if Oregon was the 4th one. And I already explained how that works in New Jersey. These other states have followed along. Actually, Rhode Island's is a little stricter. They've tied it to building code. So if a well doesn't meet all the primary drinking water contaminant standards, they can require that treatment be added, or they can condemn the property. So that's a little stricter. But we certainly recommend testing for nitrate and coliform manually, and a suite of constituents, inorganics, and metals every 3 to 5 years. But again, that's private, completely up to you as a private well owner. We do a webinar called Well Care 101. It goes into all this stuff in a lot of detail. Why, when, how, why you should do it, all that stuff. So I'm not going to go over it today. You can go look at our YouTube page for that, the last one, which I think was in November, or you can wait for the next one, which will probably be in 3 or 4 months. And with that, I know it's 3 Central Time, so I'm going to pull up the questions from that we've gotten. I forgot to enlarge this. I apologize. I'll do that right now real quick. Yeah, we got to ask, will our funds be cut? You know, we are grant funded by US EPA. And so I'm sure that's a question on not only my mind, but all of my staff's mind. And, you know, the bottom line is the program that funds us for our water operator and our private well class are part of a larger technical assistance and training grant program that funds RCAP, Rural Water, and the environmental finance centers around the country to be the boots on the ground, helping small rural systems, mostly with their water and wastewater issues. So these are small towns that maybe, you know, now they have PFAS and they have no way to deal with that. They need a grant. So the RCAPs and Rural Waters of the world go out and work with them, help them apply, give them advice on treatment. Most of them are licensed water operators. And so it's a really worthwhile program that Congress has always shown bipartisan support for. And so I'd like to think in the end that'll prevail with all the chaos that's going on today. Because, you know, it serves quite a, I mean, I think we provide quite a service. And, you know, I don't think if I was asked to sit in a chair and defend our program, I think I could do a pretty good job of showing how many people have used it, how many people it's helped, how much awareness for private wells have happened in the country since we started. And we've had a hand in that. So not to toot our own horn, but you know, it'd certainly be a real shame for all of us, not only our jobs, but for the benefit it provides to the 23 million well owners out there. So yeah, that's all I have today, because I don't know what's going to happen. I really think as they look at each of these things individually, they're going to, I think it's got a pretty fair shot of not being bothered. I'd be surprised. Will steel overtime affect the water quality later in time? Oh, overtime, there should be, I'm sorry, I am slow. That should be overtime. will still over time affect the water quality later in time if used in a potable water well. I don't have any information on that per se. It's certainly, if water's corrosive, natural groundwater can be, it's going to eventually start eating it, all that. But we see, there's more, like in bedrock, there's a lot more metals in rock that if the water's corrosive, it's going to leach them out of that than the casing itself. I don't know if there's been any studies done on that or looking at that, but it's a pretty tried and true. It's not straight, it's went through a lot of testing. There's only a few types of pipe you can use if you're following ASTM standards. And so I think it'll hold up. And I think it's for one, it's a lot more sturdy than PVC. But yeah, I don't know that it's ever caused any, certainly there's no widespread evidence of any kind of water quality problems from that. So so I don't have a better answer there. So as an EHP, I inspect facilities such as parks, hotels, restaurants that have their own well used by the public. It seems like if these facilities don't meet state criteria for public water systems, they aren't monitored by anybody except our local health unit. And we have a requirement to test the presence and absence of coliform E. coli monthly. Okay, so this is because they're considered a non-community water supply. So they're a different class of public water supply. A public water supply means you're serving to residents who have homes and drink the water every day. A community water supply. A non-community water supply is a business, a school. All these places you mentioned are called non-community water supplies. And they are mentioned in the Water Use Act, and they do have requirements. I don't think they're as stringent. I know in some states they test for more than coliform and E. coli. But I think there's a minimum level that every state has to do, and some states choose to do more. So that's probably why it's different. But if hotels and a restaurant are going to meet the definition of a non-community water supply. And there's two types. There's transient and non-transient. Non-transient is where the same people are going there at least, I think it's 6 months or 180 days. I might have that wrong. So it'd be like a school where kids are there. The same kids are there every day. Or an office or a factory where the same workers are there every day drinking that water. That's a non-transient, and they have more rules than a transient does, which is like a rest area or a restaurant or or in parks and hotels, all the ones you've mentioned. And they have less rules because somebody may be at that park 2 days a year or go to that hotel one time a year because they happen to be in town, or visit that restaurant less than once a month. And so that's probably what the rule is. I'm not as up on that. I should be through our water operator program, but I have another person who runs that. So he's the person to ask. But I'm sure that's why you only have to test for coliform and E. coli. And it's probably the same in most states. Because again, the Safe Drinking Water Act is a national rule. Every state has to meet it, but some states choose to do other things or in addition. So for instance, I believe in California, the arsenic standard there is 5 instead of 10 parts per billion. They choose to make it more strict, or it might be 2 actually. But it's like Illinois passed a rule about source water protection plans. Not every state requires them. Illinois does, because they want to see how we're mostly groundwater systems in Illinois for our public water supplies. And so, Is there anything else I should be looking at? Routine inspection or initial plan review for a facility? Large park has multiple wells. Should each well be tested monthly? I would say yes, they should, because every well, especially in a park, depending on where you're at, a lot of those end up being the older dug wells or bored wells. The water quality is going to be very different and very local. Someone could have dropped something near one of the wells, and it's going to have something else in it that none of the others do. And so, and everyone has its own well cap or well top, depending on the type of well it is. And so a lot of those wells, it's not, the bacteria isn't about the aquifer. The bacteria, if you have bacteria in your well, it means that there's a way to get in the well near the surface. So even a properly sealed well, if it has bacteria, that means somewhere there's a breach where things from the surface can get in, because coliform bacteria don't exist down in groundwater. You may find it in a short term, but they don't live there. So if the well's properly sealed, you're not going to find coliform E. coli down in a well. you're going to find it if it's in the well, it's because it got in from near the surface. And so definitely every one of those wells should be sampled, in my opinion. And again, I'm not a regulator, so that's still a question for your state primacy agency to ask. Oh, I was trying to hit next, didn't work. All I did is put a space in there. Okay, please provide RCAP contact for Pennsylvania for free assessment and collecting water samples. Well, if you'll email us, I can do that. Katie, you can type in, I mean, it's just info, info at, it's down here at the bottom, info at privatewellclass.org, and I can send you then the contact there. Yeah. Are bedrock wells common or uncommon, or does it just depend on where you are geographically? It's the second one. You know, typically if you have glacial aquifers, sand and gravels, it's shallower, it's above the bedrock. And if it's a potable water supply, there's really no reason to go down into the bedrock unless there's a difference in water chemistry. So you have bedrock wells where that's your choice, or if the shallow groundwater chemistry is not very good for some reason. You know, like right by a river, it may be influenced by a river. So you're gonna have, you know, just like community water supplies, if they're on a well that's down in a river bottom, it's treated like it's surface water because you have infiltration from a river getting into that aquifer close to the well. And so you could have bacteria and viruses and all the things you find in surface water. So the regs make you treat it that way. But on the flip side, if you have a decent sand and gravel water supply above bedrock, you're going to stick with that most of the time. There's got to be a reason not to. And so, but we see a lot of areas in the country that aren't glaciated. Bedrock's at the surface. You know, we drive down through Missouri. I go down there crappie fishing every year. And, you know, you're running through the Ozarks and it's all rock. And so there is no overburden, if you will, or soil to put in a bored well. It's got to be a bedrock well. So I did it again. When you have another when will you have another webinar? Okay, hang on a second. I'm going to do something else here real quick. I'm going to pull up our website. Right at the top, it's just privatewellclass.org, webinars and events. I click on that, it shows you all the upcoming webinars, including today's and all the ones we've just had where you can get to the recording. So it's just go to our website and click on webinars and events. There'll be one, it's actually on the 18th of February. And it's one we only do once every year or so called How to Find Local Information. But it's important because people don't realize all the information that's actually available to them nearby a lot of times. What AI model are you using for the chatbot? You say it was created from your materials. How? We use a service that's a company that develops, that does a lot of the customer service side of things. So big companies use this service, it's Intercom, to manage all of their customer service. So we're talking like the AT&Ts and Coca-Colas of the world, where so many people are calling them and they have staff that are taking calls and all that stuff. So we use that. They'd have this chatbot feature. It's their internal bot, but it's populated by our data. So we're not going out on the web to pull out information. We fed it what we wanted. So it's kind of like, what's it called? Notebook EM or something like that is another one that's like Microsoft product, I think, or something. But it's, I don't know which bot it is. I just know that when I put in questions that I know sometimes we get different answers for, if you put it out on like Google and search, because different people in different parts of the country have answered it differently, I get an answer that I'm happy with because it's, you know, it's mostly based on either my words or things I've written. And so, and I don't mean that in an arrogant way. I mean, we're consistent. And so, yeah, we just had to feed it all in. And so I, you know, we did that at the very beginning. As we add to the knowledge base, it's searching that. So the more we add into it, the more it's using those materials. But what's cool about it is it doesn't give like just the canned answer from one of the articles. It looks at all the articles. And if there's any pieces of that that also go in, it gives you even a more complete answer, which, yeah, it's really cool, I think. But, and we're just getting into that. I think there's gonna be a lot of uses as long as we manage it. I'm not a fan of using these AI models and going out on the web. What I've seen, I just was at a conference and gave a presentation, and the people that run this conference chose to take my abstract and run it through an AI model to make it shorter. and they completely changed the meaning of my presentation, or what it completely changed what it thought I was talking about. So I had to get a hold of them and say, this is not my presentation. I'm not talking about any of these things. And it's because they ran it through by itself, just, 2 paragraphs, and it really screwed it up. And so I don't trust it. And so, we've checked this out. We believe it's doing what we want. And it's an internal thing to Intercom, the company. And it's a service we pay for so that we can, take everybody's calls and develop this site so that you can find information. What are your thoughts about the USGS interactive PFAS map issued in October? I have not looked at that, to be honest. So I don't want to badmouth the USGS, but sometimes they take data and they apply it over very small areas where it's not meant to be applied. And the example I mentioned earlier, I've done a lot of arsenic research. I spent 10 or 15 years looking at arsenic in aquifers and all the mechanisms for that, and in private wells and things we can do. They developed a model to predict arsenic. And, at some scale, it was using USGS data from all the NAQUA studies and everything else they do, and it wasn't that bad. Then they tried to modify the model, and they tried to predict for every county in the country. And what I can tell you about Illinois is the counties that it shows as highest are actually the counties where we have very little or no arsenic. And some of the counties where we know there's a lot of arsenic are the ones that it shows are lower, there's none. I think it's a misapplication of the data, and it's trying to do too much with their modeling. And again, I have not looked at this map at all, but PFAS, as triggered as it is and as little as we know about it, it seems very premature to put out a map for the country saying this is your probability of PFAS in wells. Working with, in one of the podcasts I showed, there was Dr. Jackie McDonald Gibson. She's a professor at North Carolina State. She's been funded by US EPA for a number of years to look at PFAS in wells. She's done a ton of work. I had a person call me in Maine who has PFAS. We looked at all the information that was available. We got Jackie on a call. We actually worked with this community. It's a small community, all private wells. And the bottom line is it's likely their septic is causing that issue. And so to say that you can predict that based on what one person's septic system has versus another, or land applied waste, we know that's a huge issue. They're just now studying all of the land applied stuff from wastewater facilities, and PFAS is showing up in a lot of these fields. How far is that migrating? A lot of those studies are just now getting underway. My advice is not to be worried about what this says, because I doubt it's actually got a lot of grounded accuracy for private wells. I am going to talk about them. I think it's poor science. The arsenic map certainly is poor science because they're using it at a county level and it doesn't belong there. So I will take a look, and please email me. I will glad to follow up. And if you're from the USGS, sorry. That's just the way I see it. My own opinion, not the opinions of the survey or the EPA or anybody else. How can we be updated on the conference in May? So I'm not sure what you mean by updated. We had trouble getting, working for a large university makes paperwork and bureaucracy very large and complicated as well. And so we worked for several months just to get all the hotel arrangements done. And it's put us a little behind, to be honest. But as far as we hope to, it won't happen by the end of this week, but hopefully by the end of next week, update our page and actually have the registration, the hotel information, all that stuff. We've already got a button that we can put on our website for the hotel, but we don't have everything else ready. And it's just, we're a small crew and we're pretty busy. We've been lucky. We've been very good at what we do, so we've been getting more funding, and trying to ramp up staff is always a challenge. And so we're all working really hard to make sure this all happens. And if you submit an abstract, we're still going to close that on February 10th. For the other conferences, I've never actually had a call for abstracts because I've already knew the people that we wanted to come talk, and I have about half the talks that way. There's a lot of really cool things going on that'll be really interesting, I think, to a lot of people. and I'm trying to get all those folks to be there. You can also email me, and if you email info@privatewellclass.org, I will respond with my email, and we can have a conversation, and that's for anyone. Matter of fact, I think an hour from now, when this is over, or maybe 2 hours, you're going to get an email that says, thanks for attending, and it's going to be my email address. So I'm more than happy to talk to anyone who's on this call. All right. Thanks for hanging out for an extra 20 minutes, those that are here. I think that's karma because I put that on that slide if it goes over. So yeah, for those that stayed, I appreciate it. And again, just reach out if you have any questions. Thank you.